and then like halfway through, it's like, oh damn it, I forgot to record it. So
No worries. No worries at
so
all.
so I just hit the record button. We got people joining right now, guys. Thank y'all for coming out for this chat this evening. I am really pumped up. Like I come out here on Zoom sometimes, and I've always got that good Wayne Brady energy, right? But I am really excited for this topic that we're gonna talk about. I'm really excited for how this is gonna go down. I'm really excited for the medical professionals that have already assembled on this call and what's gonna proceed from here. So I had the good fortune of a couple of years ago of meeting Dr. Newton at NOCO in Colorado. It's the largest hemp convention in North America, and we just kind of randomly stayed in touch here and there. And I couldn't have been more excited when I saw that he published his book, Endocannabinoid Medicine and Pharmacology, which is a guide for physicians and pharmacists. And when I saw he released this book right off the bat, ASAP, bam, I went on Amazon and I'm like, man, this is about the endocannabinoid system. I know this man has put a lot of time, energy, and effort, into this information. And I'm thinking to myself, man, I know this book is probably going to be $50 to $100. But you know what? Screw it. I'm gonna get it. I'm gonna support this cat because this is an important topic, and I'm always thirsty for knowledge, trying to learn more. Man, I go on to Amazon. This book was less than $20. You hear me? Man, I threw my card at the computer. I'm like, take my money, because it's so important. And then I get the book, and then me being a Southern boy from Mobile, Alabama, right? I like my big font, I like simple words, and I like understanding what's going on. So this book truly, met all of those needs. I'm able to understand it. I'm about halfway through it. I'm looking at some case studies, right now. And man, it's great information. And I can't wait. If you guys don't already have this, I can't wait for you guys to go and get it yourself. And I wanted Dr. Newton to bring the message straight to you guys this evening, himself, and have an opportunity to tell you a little bit about his journey. So with that said, Dr. Newton, can you hear me okay?
Yes, yes, I hear you perfectly.
Awesome, awesome, man. Thank you so much for taking the time to come out here and just kind of chit chat with us for a little bit. This is one of those things where it's kind of no holds barred, but
Yes.
with respect, guys, because JJ is known for kicking your ass off of Zoom if you disrespect a guest. Don't do that. But like legitimate questions that you have and things that we need to talk about, man, let's do it. I've had the good fortune of listening to Dr. Newton speak. I know he can speak on a myriad, of things in regard to the endocannabinoid system. And the first time I heard him, I was like, man, this dude, he's already touching on everything that I talk about when I teach my seminar. Yes, this is awesome. So I'm really excited for him to tie in. Dr. Newton, thank you for everything that you've done within this space and everything that you will continue to do. And
Appreciate
right off the bat, I got to ask you, like, I know that there's a lot of missing information in the medical community when it comes to the endocannabinoid system.
that.
So,
Yes.
like, at what point or like, how did you make that shift?
Yeah, so thinking back and just kind of going through education, even training at one of the top medical schools in the country at UNC Chapel Hill. I did rotations at Duke Hospital. That whole area, the Raleigh Durham Chapel Hill area, that's one of the most highly respected areas for research in the world.
Hmm.
And if you look at the different states and how we have different rules and regulations, and it wasn't until I trained in Vermont, where I did my pain fellowship, that I really started learning about cannabis and how it could help patients. I did have my aunt that told me her personal stories about how it helped with her sarcoidosis. And so sarcoidosis is an inflammatory condition of the lungs. And she would
Right.
report to me that her breathing was better. She just felt so much better with the sarcoidosis. And at that point, I was thinking in my mind, okay, well, maybe it's just her anxiety. Maybe the cannabis helped with her anxiety. But then later on, after further investigation, you see that some chemovars, so some chemical varieties of cannabis, can have five or more anti-inflammatories. And
Right.
so that would definitely help a situation where you have inflammation in the lungs. It would definitely help breathing. And if you even look back to the early 1900s, when physicians could prescribe cannabis before it was actually illegal through the Marijuana Tax Act, it was in our pharmacopoeia books. So in the
Right.
early 1900s, one of the indications was actually asthma. And so asthma is of course, not just constriction of the smooth muscle, but it's also inflammation over
Mention.
time. And
Right.
so even back then, patients would receive tinctures and they would have improvement in their asthma. And
Wow.
one thing that I found through journaling over time, I mean, not just in the cannabis space, but also journaling and pain management, journaling as I rotated through my pain fellowship in palliative care,
Hmm.
in neurology, in orthopedic surgery, and neurosurgery. So I'm rotating through different departments during that pain fellowship and journaling with what the patients were getting benefit from. It was tremendous. So anything from pain management to mental health to insomnia to patients dealing with Crohn's and abdominal pain, dealing with migraines. So you see this wide variety of conditions, some directly, some indirectly related to pain, where patients are getting benefit. And so through that journaling, I just started going deeper into the research, not just the research in the US, but also research in other
Yes.
countries. So, for
Right.
example, Israel has been ahead of us in research because we passed that 1937 Marijuana Tax Act that prohibited cannabis among the states. And by the way, ironically, the first state to prohibit cannabis, which was California, was the first state to pass it for medical use in 1996.
Yeah,
So,
that's crazy.
that tells you a lot about how the history and the story of how cannabis has progressed. And with thinking about the book, keeping that in mind is I was amazed at how well the patients were doing. And keep in mind, I'm a board certified physician at this point, so I'm board
Mhm.
certified in anesthesiology, and I'm doing my training. So this is a year-long fellowship after I finished my anesthesia training, and here I'm learning about cannabis in Vermont. And so
Mhm.
after I finished that fellowship, then I moved down to Florida. At that time, cannabis was not legal here.
Mhm.
So you have states like Colorado where we met that's way ahead of us in education, way ahead of us
Right.
in research. You even have the colleges there doing research on cannabis and sports, cannabis for injury patients, and some of the schools in California as well. So as it was evolving here, when it passed in Florida, I was one of the first physicians to do the recommendations here. And
Awesome.
so while our industry was developing, this is about now 8 9 years ago now, we started having conferences. And so I would go to those conferences. I would support the dispensary, support education. And at that time, we had 5 licensed dispensaries here in Florida. And I would even come in if one of the medical directors couldn't make a conference. I would come in for that dispensary and provide the physician point of view. And so
Mhm.
the physician point of view is, okay, what's the science behind what the patients are reporting?
Right.
And keep in mind, I'm focused on the medicinal benefits. Yes, there are adult use benefits, there's recreational benefits, there's a fun component to cannabis, but I'm focused more on the scientific side. Why is the patient getting benefit in pain? And then when you look at the different treatment plans, okay, how can we focus and personalize it to the patient's type of pain that they're having? And that's one of the
Right.
amazing things about the versatility of cannabis, in that you can personalize the program for a patient that's dealing with low back pain, which is the most common type of pain overall. Second most common type of pain is going to be headaches. So you can
Mhm.
have a regimen that's specific for migraine patients, and of course, incorporating magnesium, incorporating some of the avoidance of the triggers of pain. And then if you look at the third
Right.
most common, which is going to be your joint pain, osteoarthritis, rheumatoid arthritis, which by the way, this is autoimmune awareness month. So it's a perfect time to talk about things like the topical medications that can help patients with moving their hands. And so,
Right.
over time, I would just come up with different, patterns that I saw where patients were getting benefit. And so the book is really about helping physicians come up to speed, helping pharmacists come up to speed, helping PhD researchers come up to speed, helping educators come up to speed. And so, we have these groups of professionals that are among the top 1% in their specialty, but when you test their cannabis knowledge, it's very low.
Right.
And so maybe your IQ in anesthesia, like mine, is up here, my IQ for pain management is up here, but my IQ for cannabis was down here. So I was like, I have to bring that up,
Right.
especially dealing with, my patient population is among the highest numbers of patients that come to cannabis is pain management. And that's
Hmm.
going to be depend on where you survey, what state you survey. That could be anywhere from 50 to 70% of the patients are coming for pain management. And
Right.
so that's where I saw the need to raise my IQ. And so a
Right.
couple of things, in addition to journaling, what I was hearing from the patients is also diving deeper into the research. I've also done my own research projects. My first one was with Geisinger University, which they're out of Pennsylvania,
Hmm.
and that was for something called polypharmacy. And so one of the wonderful things about cannabis is you can use it to wean patients off of other medicines. So weaning
Right.
off of not just opioids, but also benzodiazepines, which are anxiety and sleep
Hmm.
medicines, weaning off of sedative and non-sedative hypnotics, that's things like Ambien and Lunesta, weaning off of muscle relaxants, that's things like cyclobenzaprine and baclofen, which by the way, they can be sedating like Benadryl, and then weaning down on anti-inflammatories. So that's things like ibuprofen, which that's among the highest as far as patients needing to be admitted into a hospital
Hmm.
from the numbers point of view.
Right.
So we all know about the opioid epidemic. There's a spray called Narcan that is the
Hmm.
rescue, but the problem with taking too much anti-inflammatories is it reduces the lining of the stomach, and you can have about 100,000 patients going to the hospital for ibuprofen, but usually it's not fatal because they'll get admitted. They may have a lot of bleeding internally because
Hmm.
if you think about aspirin, how it's a blood thinner, ibuprofen can do the same thing as it's reducing the protective lining. So patients get admitted to the hospital for ibuprofen as well. So this was one of the first studies to look at multiple drug classes and the ability to wean patients down. And with cannabis, that is not a side effect. Cannabis does not reduce the protective lining of the stomach. So you don't see that problem with ulcers as you
Hmm.
can see with non-steroid anti-inflammatories. And so my second research study was actually for paralyzed veterans. I presented that at the Paralyzed Veterans Association. And this was looking at what's the optimal dose for patients dealing with traumatic spinal cord injuries. And I have another research study that's coming up it's going to be starting in the next few months. And that's going to be basically an extension of the first research that I did, which was for polypharmacy. And this is going to be looking at, okay, so, you have a patient dealing with pain. They're taking these specific products, and then are they weaning down on the medicine? Are they having any side effects? So this is more or less diving deeper into what's the most effective for migraines, what's the most effective for back pain, what's the most effective for osteoarthritis, for rheumatoid arthritis, and getting, so with this book, we're scratching the surface, right? We're scratching the surface. And so what this is geared toward is educating physicians that we have a type of cannabis in our bodies, and that cannabis is called the endocannabinoid system. Just like we have natural anti-inflammatories, we also have natural antidepressants. Have you ever heard of dopamine or serotonin?
Hmm. Absolutely.
Perfect. So that's our natural antidepressants. We even have a natural morphine in opioid. I don't know if you ever heard of endorphins, endogenous
Yes.
morphine. So when we let's take athletes for example. So when athletes exercise, they get something called the runner's high. So there's an
Because the
elevation in the
endorphins.
body's cannabis. There's an
Mhm.
elevation in the body's morphine. There's an elevation in the body's antidepressants, such as dopamine and serotonin. And not only that, some people have a deficiency in their body's cannabis. And so that's associated with migraines, it's associated with fibromyalgia, it's associated with IBS. So if irritable bowel syndromes is associated with that as well. So why is that important? That's important because if you have a patient that's dealing with an endocannabinoid deficiency
Mhm.
and you can help supplement that, you can essentially treat the underlying disorder with cannabinoids. So it's not just a matter of covering up the symptoms. You're literally treating the underlying disorder. So when we talk about, and dive deeper into it, products like what you have, like with your CBD and your CBG,
Mhm.
those products, and like what we have here in Florida as well, is one of the advantages of the CBD is it boosts the patient's own cannabis. So not only are you getting an anti-inflammatory, you're getting a pain reliever, you're also helping the body increase its own internal endocannabinoid system, your own cannabis. And I know we're getting kind of maybe I hope we're not getting too deep into the science because I don't want to lose anyone, but I just want you to know the importance of this. And this is just one of several mechanisms discussed in the book. I mean, in a few minutes of explanation, I can't give you everything that's in the book. It's impossible to do it in such a short period of time. But I just wanted to show you that, and then impress upon you that this is a tremendous tool, and it's less addictive than opioids. It's even less addictive than things that's over the counter like nicotine.
Hmm. Absolutely.
So if we can better understand this, we can overcome polypharmacy. So we can overcome patients being put on one medicine for pain and then another medicine for the side effects, which is usually constipation, nausea, vomiting, or itching. We can also lower, so this is called harm reduction. We can lower the risk of the patient having a severe complication. So whether that be overdosing, such as in opioids, with benzodiazepines, if you stop them abruptly, you can have a withdrawal seizure. As I mentioned, with nonsteroidal anti-inflammatories, they can cause ulcers of the stomach. And so, with cannabis, is not a side effect. It doesn't have a side effect that's in that same profile of the amount of harm that can be done with these other medicines. And so that's what the book is focused on. And I know it says it's a guide for physicians and pharmacists, but it's more than for just for physicians and pharmacists. So yesterday I was at a Parkinson's conference, and as you know, that dealing with Parkinson's and neurologic conditions, a lot of patients benefit with cannabis. And I was talking to a neurophysiologist, and so this is someone who's primarily clinical. So she left the academic world. She's only seeing patients now, and even she wasn't knowledgeable about the endocannabinoid system. Now, keep in mind, the brain is her specialty. And
Mm.
how could
Wow.
you not be knowledgeable about one of the most abundant receptors and one of the most abundant neurochemicals in the body? And you can't blame her. It's just where she trained at.
Right.
These are top institutions, but they're not top institutions for endocannabinoid medicine. They're top
Right.
institutions for maybe for Parkinson's or maybe for Alzheimer's, but this is more or less a new wave of medicine that's developing and going to continue to develop as we're seeing more research. So here in Florida, we're funding more research projects. University of Florida is doing some research studies. FAMU, which is Florida Agricultural and Mechanical University, is one of 4 HBCUs here in Florida. They're becoming one of the top educators and researchers in cannabis. FIU, Florida International University. I've had some events recently in Atlanta area. It was attended by medical students out of Morehouse Medical School, and some of the faculty was there as well. I've also been advocating for cannabis among not just the pain and mental health world, but also the neurologic world, because there's so many neurologic conditions where there's additional side effects. So, as you know, the seizure medicines can affect the bone marrow. They can cause anemia. There's so many different side effects with that as well. So, not that I'm trying to take over every specialty. However, I would like to at least introduce them to the endocannabinoid system so that they can apply it for their own patients.
Right, right. Um, one of the questions that I have to, and guys, I don't want anyone to think that this is a thing where you can't unmute yourself and ask a question. Anybody at any time can unmute and ask a question. That's just how I roll when I'm out here. I want people to have the opportunity to ask the doctor question. You ain't got to type it in no chat because I disabled the chat feature. So you ain't got
And I
no
do, and
choice
I
but to unmute,
and
you
I do
know.
have to go shortly. I do have to go shortly, but I am open to coming back. I'm sorry that I have about 5 minutes, but yeah, yeah. What questions do you have?
Well, I was just gonna ask, why aren't there more more CBG related studies? Or do
Yeah.
you know of any? Because CBG has the ability to target a lot of these same receptors as THC, and a lot of people are worried about their jobs. They're worried about, if they get a medical card that doesn't protect you from not getting fired if you have THC in your system. So, like, are you aware of more CBG specific studies for things like cancer? Because we know about Rick Simpson oil, but that's a heavy THC concentration. You know what I'm saying?
Yeah, and I would say the reason behind that is because when we look at the most common chemovars, so the most common chemical varieties, the majority of those. Let's back up. So for the listeners, CBG is basically the mother of all cannabinoids. So it's the
Mhm.
precursor to the THC, the precursor to CBD and the other cannabinoids. And why is CBG important? Because CBG, number one, is being in that category of the phytocannabinoids. There's tremendous potential benefit. Now, is there actual benefit? Are the patients reporting benefit? So how would we study that? So we would have patients take CBG, but I would recommend don't do it isolated because you would lose the entourage effect. So the entourage effect is where you have the combination of what else is in cannabis that's beneficial. So you have the terpenes that's in there. You have something called chlorophyll that's in green plants. That's also in cannabis because it's a green plant. And so this anti-tumors benefit with isolated chlorophyll by itself, and that's in preclinical studies. So one of those studies, and by preclinical I mean like either animal or human cellular studies. So usually the way it progresses, you do preclinical and then you do clinical. So then you study, once you find out something is safe, then you study it in humans to find out the right dose. So in preclinical studies, chlorophyll by itself has anti-tumor properties. CBG has anti-tumor properties. The terpenes, which is what give cannabis the different scents, the different colors, has anti-cancer properties. So I think ideally, specifically for anti-cancer, that'd be the best avenue to study it if you're looking at how it can benefit patients. So you would do like a full spectrum product with CBG incorporated into that. And the great thing about that is CBG is non-psychoactive. It wouldn't be positive on a drug screen, so it wouldn't affect somebody, the work status and things like that. And that would, I would say, be one of several studies, several ways to design that study. And so what you would want to make sure is you're not underdosing the patient. So we have something, with the different routes how we take the medicine, that only a certain percentage of that gets into the bloodstream and then gets into the organ where the cancer is. So
Mm.
if you were going to design a study, let's take brain tumors for example. If you want to study CBG in brain tumors, what I would recommend is focus on the terpenes that are lipid soluble because the brain is mostly fat. So you have a certain amount that would get into the bloodstream, but then it would accumulate in the brain. And so that's where you would get improvement in glioblastoma. That's where you would get improvement in meningiomas. And so that is the study design that you would want to get an entourage effect with CBG, and of course keep the chlorophyll, but then also add lipid loving, so lipophilic terpenes. If you were studying kidney cancer, then I would say study your water soluble because 20% of our blood supply goes to the kidneys, and you would want that to accumulate in the kidneys. So terpenes like limonene, for example, is what you would want to be higher in. And
Mhm.
there's even an anti-cancer study in humans. So this is in breast cancer patients where they took 2 grams of limonene and the other group took placebo. All of them had surgery to remove the tumors, but the group that took the limonene, they had a reduction in the size of their breast tumors over that period of time. So that's how you would design that study. I'm sorry, I got to go in about 2 minutes. I got some family in town visiting from Atlanta. So
Oh wow. Okay. Okay.
um,
Yeah, I wasn't aware of that when we set this up. I thought,
no,
okay.
no. Actually, they just popped up. So yesterday I was at that Parkinson's conference, and then so my cousin texted me, "Look, she said, look, we're in town. We're going to be at Disney. We're going to be hanging out. You better be available." I was like, "Okay, all right, it's family." So I was like, I gotta be on board with you." Um, so I have time for like maybe one or two other questions, and like I said, I'm open to coming back because usually, when you scratch the surface, more questions come about.
Right.
So I don't mind doing a follow up in the next few weeks.
Sure.
This is Traumatic Brain Injury Awareness Month. It's also, Colon Cancer Awareness Month. So, maybe you have patients that has questions on that. Yeah, but I do have time for one or two more questions.
Okay. Yeah. So guys, if someone wants to unmute, if you had a pressing question, please unmute and ask that question. And while they're deciding on who's going to unmute first, Dr. Newton, how do people reach you directly? What is the best route for them to reach you if they have individual things that they want to talk about further?
Yeah, you can find me on LinkedIn. Just type Terrell Newton, MD, or you can go to my website, which is terrellnewton.com. So there's the correct spelling of my name. One R, one L. Thanks to my mom. Newton like Isaac Newton.
Okay. All
Um,
right.
And yeah, those are two ways to find me. And of course through you by contacting you as well. You have my direct information, and we're always going to be in touch as
Oh
well.
yeah. Oh yeah, absolutely. I'm trying to see if somebody's gonna unmute. Nobody has unmuted as of yet. And I want to, and I don't mind staying out here a little bit longer, if you need, but guys, I am not a doctor. All right. I have a lot of knowledge. I can spit a lot of hot flames. But I am not a physician. But if there is something general that I can answer for you guys or a general industry question, I certainly don't mind doing so. But I wanted, someone has a family member that's laying in a bed right now that's sick. I wanted them to have the opportunity to unmute and ask the question directly to the physician if someone has that going on.
Hi
Okay.
guys, how are you?
Hi, Misty. How are you?
Good. I have a question. I see an increasing of clientele that have um, including myself, like a hypersensitivity to THC type products where, it's not relaxing and calming, it's, paranoia. And I'm wondering if, well, either one of you could answer this question. The Magic Bullet is a product that has some of that THC in there for some of that severe pain without that paranoia. And if you maybe might know where that paranoia is coming from, I often recommend people to take a full spectrum CBD product with any kind of, higher THC cannabis product so they're getting that full profile. Um, so yeah, just
Mhm.
looking for suggestions.
Do you have the type of pain specifically,
Um,
or
it
what's the most
like
common type of pain that
myofascial, like
that you see?
I think there's a lot of
Myofascial.
myofascial pain
Okay.
type going on.
Okay. All right. So one of the great things about CBD is it inhibits the enzyme FA, so fatty acid amide hydrolase, and so that's going to increase the patient's own anandamide. And so looking at the paranoia, I would say if you could stay in the range of a 20-to-1 ratio, with that being 20 milligrams of CBD for every 1 milligram of THC, that's where I would say to start. You did include that you wanted to have some THC on board, but that 20-to-1 ratio is protective. Now, if you're finding that the patients can't tolerate that, then they're ultra sensitive, in which case, what I would say is to take 25 to 50 milligrams of CBD capsule before taking the 20-to-1 product. And so that way you have some CBD on board to counteract the overactivation of the CB1 receptor from the THC.
Okay, thank you very much.
You're welcome. All right. Well, I have to go, and I appreciate again the invite. You have some great products. I hope that you're going to tell the audience about, and
Oh,
see if they
trust
can get
me.
on board.
Yes, sir. They
All
will
right.
know about activedutyrx.com. Please believe.
All right. I appreciate you, and we'll talk again soon. Thank you.
Okay. Thank you so much for your time, and we will schedule something in the near future. Thank you so much.
All right.
Thank you, Dr.
Um,
Hill.
real quick, Misty, just to kind of piggyback on to what he said, are you doing something indica based or sativa based for these people? Are the ones that are
Yeah,
having it?
it seems like it doesn't matter. I think it's
Doesn't
just
matter?
I think it's just the THC.
Yeah. So, if, because I know some people that has the inverse effect, because traditionally
Yeah,
indica will have you in the couch, right?
right.
Sativa speeds you up. And for some people, I've noticed that there's an inverse effect, so there's that factor. And, another thing that you very well may, want to try as well is eliminating the THC altogether, and see if something with extra CBG would help get them there, without the THC, because, CBG can target a lot of the same receptors in the body as THC, but without the high. And like I said, I am not a physician. That's just what I, tell people, in general, especially, with my products, because, with Active Duty RX, we are a product line that's designed for first responders. It we're designed for anyone, right? But specifically first responders, firefighters, paramedics, those people who are on the go a lot, they need help, they need relief, and they don't want to worry about failing a drug test. So that's kind of what we're targeting. And if there's, everything that I can do, to help, What state are you in by chance, Misty?
Yeah, Wisconsin. So we do not have a medical program here whatsoever,
Yep.
but we do have we do have a lot of stores selling, the THCA sprayed,
Right.
CBD flower. But
Yep.
So,
um and I think most people here prefer it in the form of a gummy, which isn't ideal either with all the sugar and food dyes in there, but
Right.
um
And
the
we
CBG, like, um what I make myself is actually solventless rosin.
Mhm.
But so I don't carry any um like CBG isolate.
Uh-huh. Oh,
Um
don't worry, you know me now, Misty. I will get you plenty of stuff
okay.
that has CBD in it. Please
I mean,
believe.
I'm not opposed to carrying isolates, because then you can like make custom blends for people, right? But I wasn't exactly aware of CBG, you know, directly engaging with the endocannabinoid receptor like THC does, because CBD hits the side of that receptor and downregulates, too
Mhm,
much
mhm,
THC.
mhm.
But so I wasn't aware. So I learned that new today about the
And
CBG. So I haven't even personally got to experiment with like higher levels of CBG.
let me give you my email address because I'm not gonna like put my cell phone number out on on Zoom, but let
Sure.
me give you my email address. You can email me, and then from there we will find a way to link up, and I will actually send you some research on CBG versus CBD. I have a few articles that I can send to you as well. My email address.
Missy, I want to chime in. It sounds like you're having a paradoxical effect with that THC. I am a physician actually, so I have
This,
seen that
by,
before.
by the way, guys, this is Dr. Lai. He is my business partner for Active Duty RX. So he is a pain and wellness physician himself. So sorry about that, T. Go ahead, do your thing.
No worries. Yeah,
Awesome.
so I'm a double board certified pain management and anesthesiologist like Dr. Newton over there. But anyways, I have my own pain clinic here in San Antonio, Texas, and I use the Active Duty RX exclusively for our patients. There are, with the CBG, the CBN components in our gummies and our roll-ons, patients don't get any type of psychoactive effects. But when you're mentioning the sensitivity to THC, I have some patients that have, they have those, that you have the paradoxical effect where, like JJ said, indica is supposed to give you the relaxation, but it can actually hype up your body, and patients aren't able to get to any sleep. They're hypervigilant, and then the opposite, when it comes to sativa. So, anyways, I think that personally, I think the best thing is just having CBG without the THC in it whatsoever, and it works for our patients. My pain patients are a lot of them have actually reduced or even gotten off opioids and other medications such as gabapentin. Just with the CBG gummies that we have. Some patients they're they're stuck on the opioids, but they have like low dose opioids that you're taking, and our products do not have THC in it whatsoever because I drug test them, and if every time we test, it's negative. So we know for sure that these patients can also use their opioids if they need to continue with their normal activities, to keep working, but they can also use the CBG gummies or the roll-on without any fear of having come up positive on their urine drug test.
Yep.
Yeah, and I have a lot of clients like that here too. In the Midwest, people are known, they live to work here. And so many people come in and, it's the older crowd that have never experienced cannabis before, and they do not want higher copious amounts of THC. They just want to take the edge off so that they
Yep.
can keep working. And I don't want people to feel weird and scared and like, what's happening to me,
And,
so yeah, if there's like
and I,
this golden ticket, because I've been looking for it even personally myself, because I am this hypersensitive person to THC. I get these crazy pain flares. I think it's myofascial pain, but it happens a lot with like barometric pressure shifts.
Mhm.
And um I
Yeah.
have tried marijuana, And it seems, it's like the best I can, it's like a migraine, but it's like a storm in the upper body with trigger points everywhere, and it's just hard to exist. Your whole central nervous system is lit up like a hurricane. And the marijuana, it it dampens it. It doesn't take all of the pain away, but it definitely dampens the storm and the activity and the hypersensitivity to everything. But I'm scared to even go there because of that hypersensitivity with the Delta 9, which makes it so uncomfortable. And through my business, I'm finding more and more people who are experiencing the same thing. And I believe that it's the industry shooting itself in the foot, selling marijuana products that have no CBD in it and a lot of these other cannabinoids that it needs to balance the plant out, and it's been hybridized to have ungodly levels of THC. And I do a lot of education at my store so that people know what to look for. You don't need 30% THC when you've never done it before.
Mhm. So, real quick, Misty, I think I found you on my Wisconsin page, and I sent you a message on Messenger.
Okay.
So check that to see if that is in fact you. If not, I just sent a stranger a message. They're gonna be like, "Who the hell is this?" But whatever. But if that's you, then I did right. Um,
Okay.
and the other thing, everybody hearing the sound of my voice right now, I want to give all of you guys a nugget that has worked really well for me. I know for a fact it is much easier to get somebody to rub something on their skin than it is to shove something down their pie hole. And the one mistake that most people are making when somebody walks into a store or they start trying to do their thing with their products, they're trying to get somebody to shove something down their pie hole right away when that may not be necessary. They may just need something that can be, put on the skin, has got some good nanotech that can be easily absorbed and severely reduce or eliminate. Like I've had people with fibromyalgia that have put our roll on and the pains just disappeared. I've given them our hemp balm and the pain has just disappeared like right away. And they did not have to put anything down their throat. I know for a fact, if you get somebody to feeling better through their skin, you build trust first. And then after you build trust, you can move on to other things. And Dr. Lai is a prime example of that because a lot of people don't know our personal story, but like at first I didn't know him. Like I was referred to his clinic by the VA, for my lower back. And I go in, I start talking, to him about, certain things with my condition. And I started talking about the endocannabinoid system. And he was basically like, well, what's that? He didn't, know a lot about it. So I started talking a little bit, gave him one of my cards and gave him a link, to go and, look at a video from Dr. Rachel Knox on the endocannabinoid system. And he got back with me afterwards and like, wow, that was legit. I didn't really, know too much about that. And then I gave him one of my pain sticks, right? Tristan, tell her the rest of the story about the pain stick and your first experience. Like this, I'm just talking about how trust is built and how trust is so important with patients. So please, you finish up.
So yeah, so I ended up, I'm an interventional pain management physician, so I'm on my feet all day long. I get home and my feet are cramping up, and I'm like, I don't know what the hell to do. Like it's like right at the top of my ankles. If I flex them, they hurt. And then if I extend them, then my calf cramps up. So I'm just like at a loss. And so I decide, well, I'm gonna try this stuff. And so I rub it right along my ankles, and that pain just goes away immediately. And after that, I'm like, well, hell, maybe I'm gonna try this on my low back because I mean, I'm a military veteran myself. 24 years in the Air Force. I beat my body up, and I have low back pain, so I tried it on my back, and I was like, man, this stuff works. And so not only, do I tell my patients that this stuff works and I promote it, but I also tell them that I use it. And, I think that, I was kind of skeptical first because I wasn't sure. JJ's giving me this roll on, say, hey, try this stuff. And it's like, I'm like, okay, well, I'll try it and see what happens. And, I'm a believer, so now I'm a believer. All my employees in the clinic use it. We got like sticks all over the place, and it's one of our biggest sellers with the roll-on. But then, once we started with the roll-ons, then, patients wanted to start, looking into the gummies, more for a sustainable benefit. So then now they take, I've got the gummies now. They're doing it like one a day. or half, twice a day or something like that. I just let them titrate it however they need to. But it works, and the patients are loving this stuff. And so, I mean, I think it just kind of sells itself.
And you hit on the main thing that I wanted, Missy and everybody else to hear. Like, I built trust with you with that. You said you wanted some for patients, and I left it at, I didn't try to upsell, cross sell. I didn't try to do shit. I gave him exactly what, he asked for. And then he came back to me on his own. He was like, hey, man, this roll on is working great, but do you have something that people can start taking, systemic, internally to start working systemically? I'm like, do bears poop in the woods? Absolutely. So we started off, with some gummies. We started off with some tinctures, and it just kind of grew from there. So that would be my first encouragement to anyone, is try to build trust through the skin first. And if they are getting some relief, now it'll open them up and build trust to do, bigger and better things. So, I wanted to make sure I told everyone that. And then the last part of Tristan's story, it kind of cracked me up because when I followed up with him on the roll on, I was like, hey man, how was that roll on? And he said, oh dude, it was great. I got the best night's sleep ever. And I'm thinking I'm scratching my head because I'm like, dude, I didn't give him any gummies. Like they definitely didn't have CBN and like what. So I had to like call him and like, hey man, what did you do? And then when he told me the story, with his ankles and his feet, I was like, okay, now that makes sense. Because like at first I was like, man, I know I didn't give this cat any gummies. Like, what is he doing sleeping with a roll on? Like, where did he insert it? It's got menthol. It probably burnt. So I was just really curious. So yeah. Misty, did that message come through to you?
I have to check here. Let's see.
Okay,
I have two other questions.
sure.
One, have you guys seen any studies on the nanoparticles and them accumulating in spots in the body where they're not needed or wanted, like they've seen with nano zinc products before in sunscreen? And then another question I have is, I have heard that topicals do not get into the bloodstream.
There we go. Yes.
And how is it possible that that THC isn't crossing into the bloodstream, you know, being applied on the skin? I don't have an answer for that, and I need one if there is one.
I'm gonna let the doctor answer that one because I'm a dumb old Southern boy from Alabama. I'm gonna let the doctor, answer answer that one.
Well, so there are peripheral receptors as well, and these products, when you use topical, pretty much hit the peripheral receptors, and then they'll start breaking down with enzymes within the body. And so before it even hits the bloodstream, the byproducts or the active products are already broken down by your body's enzymes. But if it's still hitting those receptors and it's attaching to those receptors, that's where you're getting the relief. So that's why I think that you're getting very little systemic absorption when you're using topicals.
So you won't test positive on a drug test even if there's high amounts of THC in the product?
Well, that I think is incorrect though, because I mean, if you're using a
Okay.
lot of it, you're gonna
Yeah.
eventually get enough into your bloodstream. The products we have are CBD, or THC free. That's just strictly CBD, so there is no, you're not going to come up positive regardless. The Texas law here, it's done by volume, right? So it's 0.3% by volume. And
Yep.
just like with any alcohol or any beer, right, everything's by volume. If you drink enough of it, you're going to get drunk and you're going to come up positive on the BAC. Same thing when it comes to THC. If you're using 0.3%, but then you're using a lot of it, patient's going to come up positive on the urine drug test.
So basically,
So THC
those
can
peripheral.
get into the bloodstream.
It can in larger amounts, but
Okay.
if you're using small amounts, very minimal is going to get into the bloodstream.
Okay.
And I almost kind of think about it like, if you think of a dam, right? A dam is supposed to hold back water. Well, what happens when too much water, hits a dam? Eventually it'll break, to go through to the other side. So, that's something to think about or keep in mind there. And I am going to go here. I'm trying while I'm talking to you guys, I am trying to open up my presentation right now that I normally do for the masses. And I want to show you something specifically about drug testing. Now, a lot of people don't know when I was in the Air Force, I started out as a medical laboratory technician in the Air Force. That was my first career field, and then I went on to do other things. But I started out as being one of the guys that actually did drug testing in the Air Force. So I have friends that are still in that arena. So I've been able to, acquire certain information. So I'm going to go here and do a quick screen share and kind of show you what happens from a drug testing standpoint when people drug test. So initially, when you go to a lab and you pee in a cup, right? The cup that provide the sample to, they take it and they send it to a lab, and then they transfer some of it into a cup that looks something, that will look something like this cup. And if you notice these different strips on this cup, they test for different things. Like that top one says THC. The next one says cocaine. The next one says amphetamine. The next one says opioids. Then we go down, we hit PCP, we hit barbiturates, right? But the only cannabinoid that's on this panel is THC. There is no strip for CBD. You see what I'm saying? There's only one for THC. So basically, when someone provides a sample when they first are being tested, if it's CBD or THC, this little strip could flag positive because THC is the only thing that can capture it, right? That's the only cannabinoid that's listed there. Now, what is supposed to happen is there's if you presumptively come up positive here, they are supposed to do further testing to see how positive you are, kind of like when ladies first get pregnant and you go to you provide a urine sample on a little stick. That is what is known as a qualitative test. You're looking for the presence or absence of HCG in the urine to determine if you're pregnant or not. But then ladies want to know, how pregnant are you? So they do a further test, a quantitative test, to see how pregnant you are, right? So here, if you initially come up positive, they are supposed to do further testing. And I looked at the Air Force regulations, the DOD rule, and it says here specimens that presumptively screen positive will be confirmed by a chromatography or mass spectrometry test. So to make a long story short, if you come up positive initially on a cup, they're supposed to put it on a machine that looks like this. Now, this is a $750,000 to $800,000 analyzer, okay? And not all laboratories have this analyzer, because when you look at that same sample under this analyzer, CBD and THC are similar in particle size, but they're different in particle shape. And this machine tells the difference between the two. So if you are truly worried about your job and coming up, positive or negative, first of all, don't take anything that has THC. If it doesn't say on the package THC free, verified, and tested, don't take it if you're concerned about failing a drug test. Second of all, if you do take something that is truly THC free, just know that through the process of confirming what it is, you'll eventually be negative if they do their job the way that they're supposed to. But nobody wants to pay all the money associated with this analyzer for testing. Now, this cup, that we're looking at right here, this is a $30-$40 cup, right? But to put something on this analyzer here is like a $300 test, or to three or above, per specimen. So now you can see why a lot of employers say, hey, no, you can't take any cannabinoid based products, because they don't want to pay for the additional testing associated with that to confirm that you're not positive. And that's just the God's honest truth. Does that make sense? Are we okay? I still see people moving around, so we're still here. So yeah. Um so that answers, hopefully that answers that. Misty, you good to go?
I did get your message. Thank you.
Okay, all
And
right. And you
do
the
you,
other thing that you asked about was the nanoparticles, about them accumulating over time, right?
yeah, because like if you remember the zinc oxide in sunscreen, people didn't like, that it made their skin white. They want to look nice and tan at the beach.
Mhm.
And so then they made a nano zinc oxide that absorbed and went into the skin a little bit deeper, and then later, so that you don't have that, so much of that whiteness when you put it on and wear it. However, they found that it was accumulating in organs because of the particle size, where it's accumulating in different organs like the lungs and things, where it's absolutely not supposed to be there. And
Mhm.
so, I so far have been very leery about nanotechnology type products because, obviously, because of particle size and, where it can end up into the body.
Right. I think one of the things that you have to look at is the quality of the particle. What is, accumulating? Is something accumulating in your body that's bad for you or something that's okay? That's one of the things that has to be looked at as well. Above and beyond that, I am out of my scope when it comes to answering that in any more detail. So, definitely when we get Dr. Newton back out here, again in a couple of weeks, we can definitely, do a part two, follow up to that. I want to make sure you get a legitimate answer to that.
Thank you. I appreciate that because this is something that I don't hear people talking about. I hear people talking about the studies showing higher rates of
Right.
absorption. And I'm going, yeah, exactly. Where?
Yeah, yeah. No, it makes sense. But like I said, I think one of the things that you have to look at is, if we're talking nanoparticles and cannabinoids, well, we are supposed to have cannabinoids in our body. We have an endocannabinoid system, but we don't have an ibuprofen system. You see what I'm
Right.
saying?
Right. No,
So,
but I'm specifically talking about, yeah, the nano
right.
CBD,
Mhm.
because you're reducing the particle size, that is that the particle size in nature, or is it larger in nature?
Right.
How are we receiving it? And maybe when you smoke it, it is more like a nano-sized particle. I'm not sure, but I think that it's a discussion that has to be had in our,
Oh, absolutely.
and in our industry, like, do we know?
Do
Yeah, it
the
could
same
have a
thing.
better absorption rate. So does nano zinc oxide, but that's the whole problem with nano zinc.
Right. Right. And then,
Do
and
do
then,
the same thing.
I'm sorry, David, did you say something?
Oh, I'm sorry. I thought I was muted.
Nope, you didn't mute yourself. So
Oh, I'm sorry. I thought it was automatically
stop
muted.
interrupting, David.
I
Mute
know it.
yourself. Don't be a
I'm so
distraction, man.
sorry.
I don't
Yeah,
even
that's
know who
the.
David is, but I'm just giving you guff. Don't worry about it.
Listen, you're not the first to give me grief.
No, 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 it's all good.
Well, I just came in. Are we just now starting? I feel like I'm coming on the trail end of it. Dr. Newton, I was texting with, and he said it started at 7 Eastern.
Yes, so we're kind of on the tail end of it. He had some unexpected company
Oh,
that came
yes.
into town. This
Yeah.
is a recorded call. So everything that he talked about in the beginning, all you have to do, are you a guest of his, David?
Yes, I am.
Okay.
I'm in the peripheral neuropathy business,
Okay. What state do you currently live in, sir?
Alabama.
Oh, I am in Mobile, Alabama right now
Get
myself.
out of here. I'm in
Yeah.
Birmingham.
Okay,
Well,
okay, all
actually,
right.
Leeds, the home of Charles Barkley.
Okay. Well, do me a favor.
Yep.
So I have a page for Alabama,
Yeah.
where it's called Alabama Hemp Growers. If you would
Uh-huh.
please go and request access to that on Facebook, I'm gonna have this recording posted to that page tomorrow. So that way you can see exactly what he covered in the beginning. But we are going to do a part two with him within a couple of weeks. That way we have a little bit more time with him. But like I said, he had some unexpected guests coming to town, and he had to
Yes,
jump.
he told me that. Yeah, that's great.
Yes. But we
Well,
did
wonderful. I thought
like I said, he was out here initially, and we did get a chance to talk to him for a little bit.
he was going to be on tonight. Was he?
I'm sorry, what was that again?
He told me he was going to be doing a Zoom call. I thought he was going to be speaking.
Yes, he was. Yeah, that's what I'm saying. He was speaking.
Oh,
We
okay,
were doing
okay.
a little bit of Q&A, but he
I
was
got
only
you.
able to be with us from 6 until 6:30. And I just found
Okay,
that out when we got on the call. I didn't know
I
that prior
understand.
to getting on the
And tell
call.
me your name.
My name is James Johnson.
James Johnson.
Yes, sir.
Okay.
Bill collectors call me James, and my friends call me JJ.
Yeah, there you go. There you go. And I can get your contact information again. How?
Yes, sir. First of all, my email address, it's James, James,
Mm-hmm.
at jjgro.com. That's my email
GRO. Okay.
address.
.com. Okay.
Correct.
Yeah.
And
Great. Well, nice to meet you.
Nice to meet you as well. I own Facebook pages for 27 different states,
Oh
and
my goodness.
Alabama is one of them. And like I said, if you just, go on Facebook and just look up Alabama hemp growers and just request access to it, I'll let you in
Hmm.
and you'll be able to see that recording when I get it posted tomorrow.
Yeah, I have a actually my I've got an airplane. I just sold it, but anyway, he also flies for a guy in Alabama that apparently has the rights to it may be cannabis for the state of Alabama. Um, and so anyway, but to grow it,
Okay, okay, I
yeah,
see.
to
So
grow
he's
it.
probably going to be someone who has one of the licenses to grow with
Yes,
legislation that they're in the process of passing. Makes sense.
yeah, he's doing very well apparently.
Hmm.
So I'm very interested in this, especially is it would be good for neuropathic pain, exactly like neuropathy.
Yes, sir.
Oh,
Absolutely.
okay. Well,
Yep.
they use gabapentin, Lyrica, Neurontin to mask the pain. I mean, we actually treat it. I'm
Hmm.
involved in the testing side, the pathology side,
Okay.
but I work with a lot of clinics all over the country. I'm a national. I've got a national business, so I've worked with hundreds of clinics around the country
Hmm.
that treat peripheral neuropathy specifically.
Yeah, I know for a fact we get so one of the things that, and I'm not trying to toot on my own horn. I'm just
Yeah,
meeting you. So I'm just letting you know I'm not, just, a dude. I'm the owner,
yeah.
I'm the CEO of Active Duty RX. That is my CBD brand. I have two other business partners as well, but we own our own CBD brand, and we actually I help a lot of people with neuropathy all the time,
Oh
through
wow, that's great.
our
Yeah.
products. And I
Well, we
actually
need to talk
owned and I
because
actually owned
I'm
a cannabis testing laboratory in San Antonio,
hmm
Texas, that was registered with the
yeah.
DEA for handling controlled substances. So
Hmm.
been able to learn a lot, since I retired. I retired from the Air Force in 2016, and since I retired,
Thanks for your service.
the past 9 years has been, cannabis education. And I thank you for that.
Yeah,
I really appreciate it.
absolutely. Well, nice to meet you, and hope to get to
Sure.
know more.
Absolutely. Like I said, please find that Alabama hemp growers page, because I
Hmm.
post a lot of articles, a lot of information. I sincerely think you'll enjoy being out there on that page as
Hmm.
information rolls in, on a regular basis. Hey, I got to pick on somebody real quick because I see him out here. I see Linnea. Hi, Linnea. How are you?
Hi, JJ. I'm good. I was actually
Good.
going
Oh,
to ask I was actually going to ask a question.
sure.
So yeah, this is kind of piggybacks a little bit off of David who's just speaking.
Uh-huh.
But so I suffer from like a form of dysautonomia,
Hmm.
nervous system stuff. So
Okay.
I was wondering, like, obviously you guys focus a lot on pain, and
Hmm.
now you're starting to get into the neurological, how to help
Hmm.
people with like neurological disorders.
Hmm.
So yeah, I was wondering, yeah, um what
So,
what what have you got on, like, yeah, nervous system
all
stuff?
right. So look, so here we go. Look, because I spent some time with you guys in Colorado. All right. So
Yes. Yeah.
I know how they get down with the get down in Colorado. Here's the main thing you need to know. Smoking, when you set cannabis on fire, you actually metabolize certain cannabinoids. So you never get the medical benefit from them. So I would say having a full spectrum cannabis oil product that you're dealing with without setting it on fire will give you access to certain cannabinoids that you don't have access to the minute you set the plant on fire. For instance, you have THCA and you have THC. With THCA, the A stands for acid and it's a way more concentrated form. But the minute that you set that plant on fire, it metabolizes that acid and converts it over to THC. And so there's a lot of them that, like, for instance, with COVID relief, there's been research that's shown CBGA and CBDA are two cannabinoids that actually help with COVID symptoms and COVID relief. And that was published by Oregon
Mm.
State University. Well, a lot, the crazy thing is I actually published this, I posted this article, shared it with a bunch of people, and I had people respond and they were like, yeah, bro, that's why I've never had COVID because I smoke a lot of weed. Ha ha ha.
Oh,
Well,
geez.
you never actually get the benefit of that cannabinoid because you're setting the plant on fire, you know? So that would be one thing I would suggest to you is, something full spectrum, uh, but not setting it on fire or smoking it. Maybe some drops under the tongue to access that CB1, receptor, because you're talking neurological stuff, and that's primarily a lot of things associated with the CB1 receptor. So yeah.
Awesome. Well, thank you so much. Thank you for putting this Zoom
You are
together.
very, I'm so glad to have you out here. Like, I
Yeah.
mean, let's just say you were one of the people that I met at the beginning of my journey, right after I
Hmm.
retired. So for things to be able to come around, full circle, I really appreciate you being out here.
Yeah, I love to see it. I love to see black men supporting black men, and yeah, I'm definitely gonna go buy his book. That sounds super
Yeah,
interesting. I just
I
like to
got it right
learn,
here.
so yeah.
Got it right here. It's on Amazon. It's less than, $20, and it's definitely worth purchasing. Like seriously.
Is
Awesome.
that
Well, thank you so
go ahead.
much.
Go ahead, David. I'm sorry.
Yeah, is that yeah, Dr. Newton said that he'd just written a book, has a new book out. Is that
Yes, sir.
uh
That's the
is it,
that's the book. It's
is
it's
that,
called
okay?
it's called Endocannabinoid Medicine and Pharmacology. And I think if you go on Amazon and you actually search for Dr. Terrell Newton, I think that's how I pulled it up, was I searched for his name on Amazon
Hmm.
and it
Okay.
pulled up, and then that's how I made the purchase.
Yeah. Okay.
Okay.
That's fantastic. I'll definitely get that book.
Yes, sir. And
Yeah,
please send me an email, David. I want
I
to,
will.
I want to be able to connect with you. So please send me an email, and once I get that email, I'll send you my cell phone number from there. That way we can kind of
Okay,
talk about it.
I'll go ahead and send that out to you in the next few minutes.
Challenge
Yeah, great to
accepted.
meet you, and nice to meet a fellow Alabamian.
Yes, sir.
Because
Yep. I am down here in Mobile, Alabama as we speak.
my son and daughter-in-law and grandchild live in Dolphin Island,
Yeah.
and they also have a home in Gulf Shores.
Okay. Yeah. No,
So
those are
so
definitely good areas.
so I'm coming down. I'm coming down your way next weekend, I believe.
You are.
So I think
Please
so.
send me that email.
I
I'll
will.
send you a text. We'll find some
Yep.
time to get together while you're down here if you have it.
That'd be wonderful. Yeah, I'd like to find out more, JJ.
Yeah. Yeah, absolutely. I am totally down for
Okay.
that. Please do.
Yeah.
Um,
Awesome. Thank you so much for the invitation.
No worries at all. So before we disconnect, guys, like I said, I apologize in advance that Dr. Newton didn't have more time available for this session, but we will be doing a follow-up. Please make sure when you see that follow-up, accept the invites, tell other people about it. Everybody is welcome to come out and benefit from the information. Is there anything else that I can attempt in my JJ way to answer for anyone before we disconnect here? Anybody? Theo Alexander, I see you over there in Hawaii. Appreciate you coming out here. I see Miss Iola Stallings out here, one of my OGs when it comes to my Zooms. So
And
thank
I'm
you
in
for being out
Iowa now, so hey.
here. One minute we talking about hempcrete and hemp wood. Next minute we talking about endocannabinoid system.
Look
We
at
do it
you.
all
You
out
trying to
here.
make me smart, aren't you, at the end of the day? I love it.
Look,
I
I'm trying to
love
make myself smart in the process. It ain't just about you.
Good job, JJ, man. Thanks for
it.
bringing this together, man. Keep
Oh,
promoting the products, man.
you
The
are
products
very
do
welcome,
work for
man.
everybody on the call, man. Those products are super. They're superior.
Dude, thank you so much. We appreciate the love and support. And we've got some new things coming out, with Active Duty RX. We just received a bunch of the trial size roll-ons because a lot of people don't want to buy the big size, initially. So we're gonna start putting some trial sizes online, some little like 2-3 ounce bottles for people to get. And we're just gonna keep moving forward. We're gonna do, great things, and the legislation that's going on from a product standpoint, it doesn't bother me at all because, like I said, all of our products are, there are no detectable levels of THC. We put extra CBG. And that CBG is a cannabinoid that is not on the radar with all this BS that's going on back and forth with legislation in all of these states. So that's why we're able to continue to do what we do. And we have a great time doing it for the patients and the customers. So thank you guys for your support as well. So, well, if nobody has anything else, I sincerely, from the bottom of my heart, appreciate all you guys coming out here for a little bit this evening. And like I said, there will be a follow-up in the near future with Dr. Newton as well. And let's just keep doing some good things, making things happen. Invite people out to the Facebook groups so they can participate as well and share the information. And eventually we will find answers for everybody as time goes on. So with all that said, this is JJ signing off, and I hope all of you have the rest of a great weekend and a productive week at work. Y'all take care.
Thank
Thanks.
you.
You're welcome. Bye-bye.
Bye.